Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassell, MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Hello, I'm Miles Hassell, MD. You're listening to Walk, Don't Run to the Doctor, where we talk about how you can take better care of yourself and simply need the medical profession less and be healthier for it. That's not to say that my colleagues and I aren't useful at times, but they're really overused because if people take better care of themselves, they simply don't need doctors as much. And so in terms of taking better care of yourself, today we're going to be talking about the microbiome, that incredibly complex ferment of bugs and foods inside your intestinal tract. And as we talk through this, you might get the impression we actually know what we're talking about, but in actual fact, nobody really knows very much about the intestinal microbiome. So we're going to be talking about the high points that we do know something about, how you can affect that for the sake of better health. As you're listening to this, if you feel like contacting us on our website, you have our text number. You can text us, you can write us a letter, you can send us an email. Thank you. So we're going to be talking about what is the microbiome, what are some benefits of a diverse microbiome, including anti-cancer effects, how do we build a healthy microbiome, and what to do, what not to do. And in general, we recommend against using microbiome supplements, probiotic supplements we recommend against, and instead concentrate on food. And the reason for that is that we really don't know what should be there. We have a very, very dim understanding of what should be there. And so it looks like you get a much healthier, diverse microbiome using food than using supplements. So what is the microbiome? The microbiome includes all of the bugs in your intestinal tract, primarily the colon. So it's lots of different bacteria, yeasts, other organisms, probably a whole bunch of things we don't even know about. And each person has their own unique sort of fingerprint, their own unique population of these bugs in your intestinal tract, and that's called the enterotype. These microorganisms participate in numerous chemical processes, biotransformation of numerous chemical compounds. They inhibit harmful bacterial growth and encourage the healthy bacteria. They detoxify harmful chemicals. They produce valuable nutrients. Primarily, the one group that we know about are the short-chain fatty acids. And looking at the short-chain fatty acids is a useful way of sort of thinking about how the microbiome works for you. It's only one part of it, but it's a useful part. And so the bacteria in your intestinal tract transform undigested food fibers, non-digestible carbohydrates, and resistant starches into many different short-chain fatty acids. The most commonly referred to ones are acetic acid, propionic acid, and butyric acid. And these have numerous properties, including acting as energy sources for the lining of the colon, the colonocytes. So they create this healthy barrier function. They regulate that intestinal barrier through feeding the right cells and blood flow and mucus production. They improve the intestinal acid-base regulation, so the acid-base regulation of the body is incredibly complex, and it's all different in all different parts of the body. They are involved in nutrient absorption, intestinal immune function, intestinal antimicrobial peptides, so these things that these proteins in the intestinal tract that act to help kill the unwanted bacteria or harmful bacteria, and alter how your body produces energy. So they're associated with obesity, for example. Throughout the whole body, in addition, they act to improve appetite control through really pretty mysterious mechanisms. Insulin resistance and resistance to prediabetes and type 2 diabetes. They increase the metabolic rate, which of course feeds back to things like your risk of obesity. They suppress cancer cell growth. And they reduce GI infections and irritable bowel, inflammatory bowel disease, these kinds of intestinal, let's call them inflammatory intestinal syndromes, but also intestinal syndromes that probably relate more to muscle action. For example, irritable bowel is a poorly understood but very, very common disorder that may be as much related to muscle action as anything else. So as we're looking at these different functions, you can see a lot of overlap. for example, many of the things I mentioned modulate inflammatory response. So if you want an appropriately maintained inflammatory system, what we tend to call the anti-inflammatory lifestyle, which isn't a very good term, but it's commonly used, then a healthy microbiome does that. Improved immunity. We've mentioned some of the things such as insulin resistance and antimicrobial effects that lead to better immunity. Control of cholesterol production and metabolism. So these short-chain fatty acids also feed back to the liver as they're absorbed into the body and alter things like cholesterol production. Fat deposition. In some ways, they seem to improve, I should say, how the body deposits fat in the body. They reduce kidney stone formation, probably through citrate metabolism. They improve brain function and mood and reduce brain aging. And this is sometimes called the gut-brain connection or the gut-brain axis. And so what do we know about some of the things that make for a healthier gut microbiome? We have excellent data for a whole food Mediterranean-style diet. So that's an omnivorous diet: fruits, vegetables, beans, grains, animal proteins, dairy. All of the foods that humans have traditionally eaten seems to improve the variety of the gut and healthiness of the gut microbiome. And in that regard, high fiber whole food diets seem to be critical to that. So the more food that you make at home and the less processed food, so that the fibers are minimally altered when you eat them. And we know from other data that these foods are associated with less metabolic syndrome, less obesity, less type 2 diabetes, less liver disease, less cardiovascular disease, less intestinal bowel disease, and substantial reductions in your risk of cancer and improvements in cancer outcomes. So the research is, as I said earlier, sketchy, but there's a bunch of lifestyle factors you can do. There's these probiotic and prebiotic and postbiotic things that we're going to be mentioning. We would recommend avoiding sugars and sweet drinks and sweet foods, processed carbohydrates, because these seem to feed the wrong bugs in your gut. Alcohol in small amounts actually seems to have a beneficial effect, along with apple cider vinegar. Antibiotics tend to disrupt the microbiome, and so they should be avoided unless there's a really, really, really good reason to use them. And there's something about maintaining a healthy weight that seems to feed back into a healthy microbiome. At the same time, healthy microbiome also helps you achieve a healthy weight. When we look at the cancer issue, one of the interesting aspects is that cultured foods, so by cultured foods we mean cultured grains, and there's everything from sourdough to fermented wheat germ and many other traditional cultured foods. More commonly, it's things like kombucha, kefir, yogurt, fresh sauerkraut. And when you look at all those, we have this enormous body of literature, and one of the papers on this is in the show notes, that look at how these seem to be associated with less cancers. And there's identified anti-cancer effects of them. And this leads us to this other idea. These foods have been eaten for the entire recorded history of humankind. And so, when you go back to biblical times, all the foods that we're talking about were used back then. And so when you think about that, you think about this concept of historical precedent. And it's unwise to argue against historical precedent, we would argue. Because if you look back at the last couple hundred years of medical science, the one group of nutritional science that's been consistently correct are the group that look at what humans have always done and maintain that. And that pattern of behavior has generally been the most reliable indicator of what is good and what is bad in terms of lifestyle choices. Still on the subject of cancer, for example, then when we look at lifestyle approaches that are associated with a less favorable microbiome, so low fiber diets, lots of refined carbohydrates, sedentary lifestyle, antibiotics, we see in that group more cancers. And when we look at better microbiomes, we see less cancers and better outcomes from cancer therapy, including things like chemotherapy and radiation therapy. So there's something about these, the healthy microbiome, that actually improves conventional therapy for cancers. Many individual studies have looked at specific mechanisms by which this might be occurring. Tumor necrosis factor A, effects on harmful bacteria, effects on good bacteria, and so on. And we really don't know which of those mechanisms are all that important and which aren't. And we see other data that looks at the progression of Alzheimer's disease and other brain degenerative diseases, and seen that those seem to be slowed with a healthy microbiome. The most commonly studied food is probably yogurt. Once again, these are foods that have been in human nutrition, because remember, before refrigeration, what did you do with dairy products? You couldn't just have a gallon of milk sitting on a shelf in a warm climate. Maybe you could in Minnesota in winter. But what they did was they turned it into yogurt and kefir and cheese, the storage forms of dairy. And these do seem to be associated with less cancer risk. And also, these fermented foods these fermented dairy foods are also associated with improvements in metabolic health. So that's the diabetes, heart disease, stroke risk. In the Nurses' Health Study, they followed about 85,000 women and about 43,000 men over an average of about 26 years. And those that had frequent yogurt consumption had less colon cancer, for example. Now, the other aspect of this is maybe people who ate yogurt made better lifestyle choices in other areas as well. And so never take any one finding in the lifestyle arena and say it's all based on that, because in all probability, it's probably much more based on a pattern of behavior. Prebiotics are often discussed in the context of the microbiome. And the prebiotics are a huge range of food components which are selectively utilized by beneficial bacteria in your body. And our argument is pretty much all whole foods are prebiotics. And so we don't get too excited about this. But a study from MD Anderson was interesting, where they had two groups. And the only difference between the two groups was one group had added beans and the other one didn't. So the beans were the prebiotic. And those who ate the beans had a favorable shift towards what we call microbiome-derived metabolites that reflect a healthier microbiome as against a less healthy microbiome. And so simple steps like this actually alter what's going on in your gut, but all revolves around whole foods. Then there's these things called postbiotics that you might hear about. So the postbiotics are these complex biological molecules that are produced in the context of a healthy microbiome that improve gut health, seem to be associated with shorter hospital stays after cancer surgery, decreased chemotherapy side effects, and including things like diarrhea. And this is something we see in practice, is the people who take good care of themselves as they're going through cancer therapy simply have fewer side effects. We've seen it in the research. We see it in the clinic. It's a very, very real effect. Take care of yourself. Don't lean into those people that say, oh, eat whatever you can keep down. Don't do that. Skip the ice cream. Skip the junk. Skip the comfort food. And instead eat good food. And make good food your comfort food. How's that for an idea? There's some specific foods that are not specifically probiotic. So when we talk about things like yogurt and kefir and fresh sauerkraut, we're talking about foods that actually introduce good bugs into your system. But then there's things that don't actually have an active microbiological component, but nevertheless improve the health of your microbiome. And the two best studied are probably apple cider vinegar and other vinegars and wine. So this has been best studied with apple cider vinegar, and typically when we're looking for metabolic effects, the studies seem to show that somewhere around about a tablespoon a day is about right, and you can use it in salad dressing, you can put it in a glass of water, diluted to taste. We aren't a big fan of taking a straight tablespoon of apple cider vinegar in your mouth. It just doesn't seem sensible. It's not pleasant for most of us. Might be hard on the teeth. Don't do it. Just dilute it. Use it in food like people always have. In addition, wine also has this same kind of beneficial effect in the microbiome. And for those concerned about wine, we actually have another podcast that's just dealing with wine by itself in terms of its health properties. But wine helps the microbiome, and in small quantities, by that I mean maybe up to 7 drinks a week in women, maybe up to 10 or so drinks a week in men, is associated with overall lower death rates, better health overall, probably neutral in those doses for cancer, and beneficial for cardiovascular disease. However, in humans following a healthy lifestyle overall, meaning they eat a healthy diet, whole food diet, they get regular exercise, they're not too chubby, they don't smoke, and they drink some alcohol, that group actually have quite a bit less cancer, maybe 60% if in the Nurses' Health Study and the Health Professionals Follow-Up Study. And so if you look at alcohol all by itself, you get a different sense of risk and benefit than if you look at alcohol in the context of a healthy lifestyle. And that's really an important consideration if we're trying to use good data. What about exercise? Oddly enough, exercise is associated with a healthier microbiome, and exercise does everything else good for you too. It acts to lower your inflammatory load. It acts as an antioxidant. It redistributes your fat in favorable ways. It improves your immunity. So think of exercise as one of the key components. Perhaps 50% of your lifestyle medicine approach should include your exercise habit. And so if you exercise, you have a healthier microbiome, and we really don't fully understand why. I'm wondering if I've really said enough about highly processed carbohydrates and sweet drinks in particular. So whenever we're looking at sugar-sweetened drinks, artificially sweetened drinks, and high amounts of processed carbohydrates, that basically means things made with white flour, or as is often on the label, wheat flour. Any of these highly processed flours, these are not good foods, and they tend to disrupt the microbiome by encouraging the growth of the wrong kind of bacteria. As I said, this is poorly understood data, but we have this broad range of data showing that highly processed carbohydrates, sugars, white flour, are associated with just about every adverse health outcome you can imagine. Everything from dementia to diabetes to heart disease to obesity to cancer. So when you're thinking about your microbiome, get rid of the sweet drinks, get rid of the artificially sweetened foods, get rid of the highly processed flours. Make your own food at home. Antibiotics. So it's not surprising if we're dealing with the microbiome, the microbiological compounds in the intestinal tract, that we would be concerned about antibiotics that kill bacteria, kill yeast, and disrupt that whole thing. And this has been, this is not a controversial area, of course. So always think twice before a doctor recommends an antibiotic and say, what happens if I don't take this antibiotic? Should I wait a couple of days and see if I get better by myself? Because frankly, most things get better. In fact, Voltaire, the philosopher, said, the physician's job is to amuse the patient while they improve. He actually said it better than that. The nutritional supplement industry and their probiotic pills are about a $40 billion a year industry in the United States. The trouble is, that would be great if it did good. But we would argue that we really don't know what to supplement. And although we do occasionally use probiotic supplements, it's really rarely and only under certain adverse conditions, such as travel and so on, where we try to use a range of them. But in general, you're far better off sticking to food that has a healthy microbiome in it. So that's yogurt, kefir, fresh sauerkraut, homemade kombucha, homemade sourdough, things like that. The cancer patient, because so much of our work is done in what we call cancer survivorship, so that's this area where we're trying to help patients have better survival from their cancer, better outcomes from conventional treatment, less recurrence of cancer, and less non-cancer disease. So the cancer patient has a lot to juggle. And babying the microbiome, unfortunately, is one of those things. And so when you're the cancer patient, think about eating whole foods, think about eating cultured foods, think about reducing your sugar intake, improving your exercise, and we often use as little as 1 minute of exercise several times a day to maintain this. And all those effects not only improve the microbiome, but we have independent evidence that they also improve cancer outcomes. So in summary, your microbiome is a critical part of your whole body health. Feed it by eating the widest variety of whole unprocessed foods you can, and that usually means foods prepared at home. Use some cultured foods, plain yogurt, plain kefir, fresh sauerkraut, homemade sourdough, kombucha. And remember, when you do all this, you're also feeding those bugs so that they're getting the prebiotics. So you don't need to get a prebiotic supplement, for example. A little bit of wine, some apple cider vinegar, maybe a tablespoon a day, also seems to improve the microbiome and are associated with overall improved health outcomes. Daily exercise, or more than daily, 2 or 3 times a day of exercise is another tool you can use. And then do your best to avoid the things that mess up the microbiome. Antibiotics, artificial sweeteners, excessive sugars, excessive foods made with full white flour. Just think about babying your gut and realize if you baby your gut, you're going to baby the rest of you. So thank you for listening. I'm Miles Hassell, MD. My practice is in Portland, Oregon. The website is greatmed.org. The book is Good Food, Great Medicine, which is now in its 4th edition. And my sister is the co-author. Feel free to contact us through the website. Thank you.